Hello, my name is Pamela Smith, and I'm a speech-language pathologist with over 20 years experience. I spent most of my career working with young adults to geriatrics in various clinical and non-clinical settings, such as nonprofits. Now, you may be asking yourself, what exactly is a speech pathologist and what do I do? Well, what we do certainly goes beyond what our title implies. Generally speaking, it depends on the work setting. For example, those working in a hospital setting will perform different activities and treatments than those working in a school. However, most of our time is spent evaluating and diagnosing disorders such as speech, communication such as AAC, language, voice, or swallowing disorders. We also create individual treatment plans and implement them. Time is also spent training family members or caregivers to oversee those treatments in everyday life so they are functional. In addition, we collaborate with other medical professionals as needed. My speech therapy specialties are pretty much generalized, but I've spent most of my time working with speech and language disorders as a result of an individual suffering a stroke or brain injury. I also work with those with progressive neurological disorders such as dementia and Parkinson's, and individuals with various voice and swallowing dysfunctions. More specifically, most of the conditions I provide assessments and treatments in are in speech disorders. This occurs when a person has a condition causing difficulty producing speech sounds, for example, stuttering, dysarthria, and apraxia. Also, language disorders. These include any condition which causes an individual difficulty understanding communication with others. This could include receptive and expressive language and can involve spoken or written language. Another area is swallowing disorders, also known as dysphagia, is difficulty chewing and or swallowing certain foods or liquids, and is common in those who had a stroke or a brain injury, as well as with certain illnesses or other injuries. Cognitive communication disorders is another area that I address. These disorders cause individuals to have difficulty remembering, organizing their thoughts, paying attention, or problem solving. Voice disorders is another. There are various reasons why a person may have voice problems, but it can lead to a change in vocal pitch, volume, or tone. It can come from medical or surgical procedures, such as trauma to the voice box. It can be age-related, excessive muscle tension, vocal nodules, polyps, smoking, neurological conditions such as Parkinson's, and talking for an extended period of time. There are guided strategies, exercises, and lifestyle changes that can not only improve function in voice, but with the other conditions that I treat as well. As for my approach to treatment, I like to keep it patient-centered, whereby I strive to improve the overall quality of life with all my patients. My therapeutic work over the years have taught me the value of listening to patients and involving them in their care. I cherish my interactions and relationship with my patients, and I celebrate their achievements during their course of intervention. So in a brief nutshell, that is what speech pathology is and what services I currently provide. I look forward to working with you.